Hello, doctors. For those of you that don't know me, my name is Dr. Phil Arnone. I am the current chairman of the Optimal Outcome and Procedure Committee, which we formerly call OPS. I'd like to talk to you a little bit about why we formed this committee. Originally, I came across the evolving problem in our profession of doctors moving away from a true model of best practice. We all know the definitions of best practice are both clinician opinion and outcome, patient satisfaction, and journal research. And there's been a great movement in our profession to ignore multiple layers of best practice and only talk about journal research. And that applies specifically, and more interesting to us, to radiographic procedures. And originally, most of you are probably familiar with the ACA's decision to move forward with the Choosing Wisely program that tended to try and create parameters for when doctors should and shouldn't take x-rays, and most of these revolved around red flags. And while I fought a great battle with the ACA about that particular policy, I realized that the ACA is only a part of the problem. The real issue is our young doctors. In some of my various positions, I've had the opportunity to tour Capitol Hill. I've passed multiple bills on behalf of chiropractic, but in the midst of that, I've also spent a lot of time at the various chiropractic institutions. And what I found is a lot of these young doctors are not being taught radiographic procedures for anything other than red flags. Many of them think that most chiropractors that take x-rays take them just to make more money, that they just do them repeatedly to make more money, that it's just more of a practice management modality rather than a true tool for us to understand how to better correct the spine. And while admittedly we have great problems with our radiographic procedures, and we need to continue to improve our ability to utilize these procedures to identify how to help patients better, how to get better corrections, how to measure what we do, our profession as a whole is moving towards throwing out the use of radiographic procedures, largely because they believe that there's not enough journal research to support it, and largely because they're not being taught how to use those procedures. And so we formed the OPS committee. I've been a NUCA practitioner for 30 years. I studied under Dr. Gregory. I'm also a bit of an odd practitioner because I've also been a pupil of Dr. Burl Pettibon for many years and have incorporated his rehabilitative therapies into our practice. And while I would say my understanding of CBP is much less than Pettibon and NUCA, over the years we've incorporated many CBP practices into our rehab practice as well. And so it was a natural process for me to kind of join all these organizations in an attempt to start looking at the research that was there. Because if people say there's no research, well, maybe we need to look and see what there is. And so we created a list of questions that needed to be answered. I'll make those questions available to you. But those questions were things like, does changing a lateral cervical curve have an impact on long-term patient health? Does it have an effect on diminishing arthritic changes through their life? Does the cervical lordotic curve diminish somebody's ability to have disc herniations in their future? And we made all these questions, and then we created a survey. We created a survey for doctors of chiropractic to take so that they can tell us how they felt, because largely multiple institutions, both chiropractic schools and our trade organizations, have decided that chiropractors feel they don't need x-rays. But really, I've never seen a survey other than our survey. And so to date, we've had over 3,000 doctors complete our survey, just explaining to us how they feel about the use of radiographic procedures in their practice and how it affects their decisions with their patients and their decisions on what type of care to provide and what type of adjustments and when to recheck those patients. We've also now set out to start answering some of those questions. On our website, we've listed over 450 articles that pertain to radiographic procedures in the use of musculoskeletal care. And we've started creating summaries for all of those articles. And we've set out to create publications, and we're in the midst of 3 of those publications right now. And our goal is to gradually introduce the profession, the chiropractic profession that is, to the information that already exists. Because people tell me that there's no research, but I will tell you, if you go to our website, you'll see that there's lots of research to support why radiographic procedures are vital in patient care. And yes, we need to move that forward, and there's probably more research that needs to be done over the course of time. But our philosophy has been, just because something's perfect, we don't throw it out. It's the tool we have, and we need to advance that tool. Our patients deserve that. They deserve us as a profession to be able to improve what we do, improve how we measure what we do, and improve our corrections. And so I've invited all of you to join our committees. I'm hoping in the course of time we will create multiple publications, both summarizing some of the research we've seen, answering the questions that need to be answered, creating new questions, creating the path for future research, and then creating studies to demonstrate how chiropractors answered our survey. And I think more importantly, our long-term goal is, as we continue to get that information, to create small presentations so that we can start educating our young doctors about the research that they don't even know exists, about how they can use radiographic procedures regardless of their technique on how to improve patient care. So that's our goal as the Ops Committee, and as I always finish up our meetings, this project is much bigger than me. It's much bigger than all of us. It'll probably outlive all of us. But as I say, if not us, who? Somebody needs to start the ball rolling. Somebody needs to be responsible for advancing our profession. And our techniques, respectively, are all the techniques that already value radiographic procedures. And so it seemed that we were a good starting point. I thank you all for your time and commitment to our profession. I look forward to having great progress and making huge changes for our professions over the years. I'll be sharing with you both the questions to be answered, links to our website, links to the survey, so that you can see for yourself the progress we've made to date and our goals for what we'll be doing in the future. Thanks again. I appreciate your time.